Non-essential surgeries are being postponed countrywide to free up hospital space, bed space. At the same time, people are also staying away from private doctors, we are told, which is said to be placing their practices in financial difficulties. Well, let's talk to health economist then. That's health economics specialist, Professor Alex van den Heever, who joins us now for a conversation on this. So, Alex, good afternoon. Thank you for joining us. So there's a bit of contradiction here in as far as the situation with bed space is concerned. Weekly, government at a provincial level, at least here in Gauteng, and in fact I know it happens in other provinces as well, will report on the number of available bed spaces and what they've been able to free up as way of capacity. And their underlying message is always, well, there's a bit of pressure, but so far we are creating enough space, whether be it general wards, high care wards, or perhaps even ICU wards. Whereas at the same time, some health practitioners are saying actually the opposite is true in that we're running out of bed spaces. What is your understanding of the situation?
So in terms of bed availability, you've got, in terms of critical care bed availability, we will not necessarily be using all the space available immediately. But with the rate at which the new cases are being detected in Gauteng, it's just a matter of time before they become inpatients. So when people are initially detected as infected, they don't necessarily require treatment, but usually there's a delay between that and deaths. So so I think that there will be a concern about a very, very large number of new cases coming into hospitals in the next 10 days in Gauteng. And that has already occurred in places like the Eastern Cape. But in respect of a lot of other services, including out-of-hospital services, there's been a drop in the demand for healthcare. And so you kind of have this, you have both floods and droughts at the same time in the health system, which is very destabilizing.
Yeah, and when you talk about the drop in demand of out-of-hospital care, do you believe that to be out of caution by people? Because, there's this sense that, going to the doctor's rooms, if you can avoid it, do, because, you don't know what you might pick up while you're there, or is it something else that you are reading into that particular trend?
Yeah, so there can be several factors that arise. One will be caution on the part of patients. The other will be that a lot of services have been terminated, elective surgery and so on. So the out-of-hospital part of that preparation will effectively have fallen away. And then you've got a third aspect when you've got practices as well as hospital-based services where doctors have privileges that have closed down because of COVID infections of staff, of frontline staff. So you've got a multitude of factors. The epidemic is having a very complicated impact on the health system. And in the private sector side, this results in the further complication that their financial viability is impacted by this intermittent and interrupted demand. Whereas on the public sector side, people's salaries remain paid. But on the public sector side, the problem is the delayed and deferred morbidity that's going to ultimately have an impact.
How much transparency and honesty do you believe we are getting from our government, particularly here in Gauteng, in as far as the readiness for the influx of patients as we reach the peak?
I think that we're, in terms of, I won't reflect it as honesty. I think that the issue is, I think we're in great difficulty, and I'm seriously concerned about what will happen in the next 2 to 3 weeks. The number of new cases that we're detecting has ratcheted up incredibly quickly. It's not the trend that we saw in the Western Cape, which was much more contained and has actually reached it's kind of reached a peak and is in a slight decline. It's not a complete decline yet, but it's now Gauteng has vastly exceeded the number of new cases. Now, this is the new cases, not the sort of historical accumulated cases, but the new cases are dramatically higher than the Western Cape, which means that we would be expecting a surge in the demand for health services soon. So because it's so dramatic, it means that not everybody's putting pressure on the health service today or within the next 3 days, but you can expect the trend to follow the new cases. So that's why within the next 10 days, the question is really whether we can cope with what is very likely to happen.
Yeah, and lastly, where do you believe that pressure will be felt the most in terms of the area of the hospital? I mean, we are told that the hospitalization figure is somewhere between 10 and 15% at a national level. Where does that go? Is it in general wards, and or is it in terms of the what is known as high care wards, or in ICU wards, and with what impact?
Yeah, so probably around about 30% of the hospitalized cases will be in what's called critical care. That's really where you require a higher intensity of nursing services. And you also require the equipment that supports those beds, such as oxygen. There's going to be a need for that in oxygen supply in general wards as well. So roughly 30% of hospitalized cases require critical care, and we have a shortage of critical care beds in the public sector. We have a lot more in the private sector, but they're also filling up with medical scheme patients who are also getting infected quite significantly. So we've got the surge on both systems. We don't have full information. It's not easy to tell the total number of cases. It's not reported on a routine basis in the public sector. But a lot can go into general ward. But it's going to be very important that those patients are properly isolated in general ward and are properly supported with treatment and doctors. And that's where it's unclear. We don't really have field hospital capacity because the field hospitals that have been set up they're not equivalent to what was set up in the Western Cape. Those were real hospital beds with oxygen supplied to the beds, and you would still have to supply nurses and so on to them. The field hospitals in Nasrec are furniture beds. They've got it from a furniture shop. They're not hospital beds. So it's a quarantine facility. It's not a treatment facility.
All right, thank you for that. Thank you for your insights there. That's Professor van den Heever talking to us there about the situation and as far as bed space availability in Gauteng is concerned. And that's